Welcome to the Roots to Health series. In this series, I'll be going over what I believe are the roots for good health. I'm Dr. Liana Call Smith. I'm a chiropractor and clinical nutritionist. Let's talk about movement. I want to call it movement and not exercise because some people still feel like that word is a four-letter word. You were created to move. Our bodies need movement throughout the day. It keeps our lymphatic system moving and keeps your joints supple. If you have ever ridden in a car for a long distance, you know that besides that joint and muscle stiffness, you also get really tired. It's really hard work sitting still for that long. When it comes to muscles, you either use them or you lose them. Muscle loss can start to occur by age 30 and only progresses as you age unless you do something about it. I personally think muscle weakness can occur much earlier. Age is certainly a factor, but so is inactivity, poor nutrition, and medications. If you have ever had that thought of, gee, I hope I don't look or move like that when I'm older, the best time to start working on that is right now. A small side note, most of us at some point will need to take care of an aging parent or loved one. If you haven't already experienced this, it is often heartbreaking. The physical decline we see is common, but not necessarily completely normal. Physical activity can help slow that decline. I personally don't want to put my family through that kind of pain. I'd rather be a young 75-year-old than an old 75-year-old. You are never too old or too young to improve your movement. Here are my recommendations for different ages and different skill levels. First, parents, encourage your kids to move. Get active with them, since telling them to be active is not near as successful as being active yourself. Encourage them to challenge themselves and do skills and not just look a certain way. This will help build a healthy relationship with movement. If you are not already doing something now, add some simple movement into your daily routine. They don't have to take a long time. Just start doing some movement. Some examples are walking, wall push-ups, squats, leg raises, balance exercises. My caveat for this, start ridiculously stupid easy. I'd rather you start off with a super short walk, a super lightweight, a super short workout, rather than hurt yourself just as you start trying to make healthy changes. Start with something you know you can do. Show up consistently, and once you know that your body is responding well, then you can increase what you are doing. If you want a rule to help you to not increase too fast, aim for no more than 10% increase in weight, time, etc. This will help prevent injury, and an uninjured body is a lot nicer to be in than an injured one. For the person that already does some activity, start to challenge yourself a bit more. Add more movement, more weight. Increase your range of motion throughout your joints. If you're doing squats, can you go all the way down? Are you working your joints through their entire motion? This helps build more strength that will only help as you age. Consider looking into Pilates or calisthenics, since these are bodyweight exercises that will encourage you to build actual skills and not just a nice looking body. For the more advanced movers, find something to challenge yourself even more. Find things that are still difficult for you and see if you can improve them. I'm not saying we should all strive to be Olympic athletes, but I do want us all to be able to use these bodies well for our entire lives. Can you go from standing to sitting on the floor and back up without using your hands? Can you do a pistol squat? Work on those. And finally, adults with aging parents or other loved ones, encourage them to move. As I said before, physical movement can slow decline. But the same as with the kids, you need to lead by example. Help them with their PT if they have been given PT exercises. Go on a walk with them. Encourage them to do things for themselves. If they have a lift chair or other assistance device and exercises can help reduce their dependence on them, make that a priority. I've personally seen a lift chair cause worsening symptoms simply because the patient got weaker. When the lift chair broke, she got better. I told her not to fix that chair, but the family did anyway, and she got worse again. Making their life as easy as possible cannot be our goal. I want them to have a good quality of life, and to do that, they need to be able to move. Sometimes we need to be a bit more inventive to add more movement into our day. Besides gym time, here are a few things that I have done to add more movement throughout my day. I actually do park further away from store entrances, so I have to walk further. It also means that I have less issue finding a parking space and getting out when I'm ready to leave. I have a walking pad in my office, and I walk 15 minutes before the start of my day. I use that time to pray for all my patients and mentally prepare for my day. I have a stationary bike that is in view of a TV, and I have encouraged myself to ride for 15 minutes at the start of a movie if I haven't done enough movement for that day. I also have tried to not be so efficient with my daily movements. For example, I'll grab something from the fridge and go put it back. Then I grab a spice and I put it back. And then I go get something else from the fridge and I put it back. If I was super tired, I'd probably be much more efficient with those movements. I'm working on adding in doing a full squat while I brush my teeth, but I need to work on that consistency. These are just some of the things that I have found that help me add more movement in my day. How can you be inventive at adding movement in your day? What level of movement are you at right now? How can you challenge yourself to get a little bit better? If you enjoyed this video, please don't forget to like it and share it with someone who you think might need to hear this. If you find this type of information valuable and wish to subscribe, do so. See you next Tuesday and have an amazing week.